They called her Ghost. The staff on the night shift at Seattle General thought it was funny, a nickname that stuck because Ashley Cooper moved through the emergency room like smoke, present but somehow never quite there. She'd been working nights for 3 years, and in that time, not a single person had asked her first name twice. They saw the scars on her forearms, the ones that traced up her wrists like angry rivers when she reached for charts, and they looked away. Long sleeves in Houston heat. Gloves that never quite covered everything. Hands that never trembled, even when the traumas rolled in at 2 in the morning. The fluorescent lights hummed their mechanical prayer above the trauma bay as Ashley moved between stations, her badge clipped to the pocket of her scrubs, reading simply A. Cooper, RN. That was enough. That was all anyone needed. She checked the ventilator on Bay 3, the hiss of air escaping through the endotracheal tube, and made a note in the chart. The resident had missed the early signs of sepsis. The patient in Bay 3 would have crashed by morning if the antibiotics hadn't been started. They would have blamed the resident. No one would mention that it was Ghost who caught it. She'd learned long ago that invisibility was safer than recognition. Recognition meant questions. Questions meant answers. And Ashley Cooper had spent 3 years learning to be someone new, someone with a different name to different people, someone who existed only in the space between heartbeats and vital signs. Her locker was in the back hallway, past the break room where the other nurses laughed about things that didn't seem funny anymore. She touched the dog tag once before every shift, a ritual, a talisman, a weight she carried that no one else could see. The chain was broken, had been for 3 years, and she'd never had it repaired. Some things were meant to stay fractured. The tag itself was scratched beyond recognition, the numbers worn smooth by her thumb, worn smooth by years of hands that had held it in darkness. She tucked it beneath her spare scrubs, the cold metal against her palm for 1 breath, 2, then closed the locker with a soft click. The break room was empty except for Dr. Prescott, the department chief, standing at the vending machine with the patience of a man waiting for something to go wrong. He was 53, with the kind of face that had been handsome once, sharp cheekbones, salt and pepper hair, the sort of jaw that convinced people to trust him. But his eyes were different now, harder, the way eyes get when someone realizes they're not the smartest person in the room anymore. He watched her move past him through the doorway and back into the ER. She felt it the way she'd learned to feel things, as pressure, as data, as information that lived in the small muscles at the base of her skull. He was looking at her the way a shark looks at bait. In Bay 4, a 28-year-old came in with chest pain and shortness of breath. The resident ordered a chest X-ray. Ashley pulled the chart and felt the pattern click into place in her mind the way patterns always did, the fever from 2 days ago that the patient had mentioned in passing, the slight crackle in the lower left lobe when she listened, the elevated white count that the resident had somehow missed while scrolling through his phone. Pneumonia. Early sepsis if they waited for the X-ray. She flagged the resident without making a scene, without raising her voice, without doing anything that would suggest she was anything other than what she appeared to be. Start antibiotics, she said quietly. Now. The resident, Marcus Chen, barely looked at her. But he ordered them anyway. Everyone did. Not because she asked, but because somewhere in the last 3 years, people had started to listen to Ghost, even when they didn't understand why they were listening. At 2:47 a.m., the doors of the ER slid open and brought with them the smell of rain, Houston rain, thick and warm and carrying the green metal scent of humidity. A 72-year-old man was wheeled in on a stretcher, gripping his left arm, face gray with pain. Acute coronary syndrome. The attending physician was still finishing paperwork upstairs. The resident froze. That moment of hesitation was all it took. Ashley was already moving, 14 gauge for in the left antecubital fossa, oxygen going on, continuous cardiac monitoring. She glanced at the EKG as it printed. ST elevation in the anterior wall. STEMI. Time to reperfusion was everything. Minutes. Not hours. She was calling cardiology before the resident had finished taking the history, her voice steady and certain and leaving no room for questions. The resident, a newer one, Thomas Whitmore, pale and trembling, watched her work. Should we wait for Dr. Prescott? No, Ashley said. This was the thing about being Ghost, she could speak with absolute authority and no one would remember it happened. Call the cath lab. Tell them we're incoming. 5 minutes ago would have been better. The patient made it upstairs with 47 minutes of reperfusion time that would mean the difference between a good outcome and a widow. Ashley stripped her gloves, they snapped like small gunshots in the relative quiet, and went back to charting. She wrote down what happened in the notes, exact and meticulous and careful, the way she'd been trained to chart. Everything documented. Everything defensible. Nothing that would draw attention. By the time Dr. Prescott arrived for his morning rounds at 6 a.m., the patient was in the cath lab. By the time he asked what had happened, the decision to go straight to the lab had already saved a life. He didn't ask who made the call. But when he saw the chart, that neat, precise handwriting documenting the entire sequence, his jaw tightened again, and he looked at the name on the badge clipped to the nearby nurse's station. A. Cooper, RN. Ashley was finishing her final hour before the day shift came in, completing discharge paperwork for a patient she'd stabilized in the midnight hour. Pneumonia, improving on antibiotics. The patient thanked the resident who was signing off on the discharge. The resident smiled and accepted the gratitude. That was the way it worked. That was always the way it worked. She moved through the hallway toward the locker room, her shift almost finished, her presence already fading back into whatever shadow she occupied in this place. The morning crew was arriving now, talking loudly, laughing about things that had happened off-duty, moving with the energy of people who existed fully, completely, visibly in the world. She thought about the patient upstairs. He would recover. His daughter would get to see him at her wedding next month. His wife would get 5 more years of mornings with him. And somewhere in that chain of causality, a nurse named Ghost had made a decision at 2:47 a.m. that would echo through a family for decades. But the patient would never know her name. The family would thank the cardiologist. The resident would get the credit in the chart review. And Dr. Prescott would wonder, with an increasingly bitter taste in his mouth, how it was that younger physicians kept making the right calls, the brilliant calls, the decisions that made him look slow by comparison. What he didn't know was that Major Ashley Cooper, who'd once directed the trauma center at Fallujah's main aid station for 16 hours straight while mortars destroyed everything around her, wasn't trying to outshine anyone. She was simply incapable of doing anything less than saving every life she touched. But that wouldn't matter. Because the moment someone noticed that pattern, the moment Dr. Prescott's wounded pride finally crystallized into something actionable, everything would change. She touched the dog tag one last time before she left for the day. Thursday grand round started like every other one, the auditorium filled with 40 physicians and residents, the kind of morning where Ashley sat in the back row with her coffee getting cold while younger doctors tried to impress the attending staff. Dr. Prescott stood at the podium with his laser pointer like a weapon, clicking through case presentations with the precision of a trial lawyer building a closing argument. She knew something was wrong the moment her name appeared on the screen. Her chart notes. The ones from the septic patient she'd caught. Blown up across a white hospital background like evidence at a crime scene. This, Prescott said, circling her documentation with the red dot of his laser, is what I call cowboy nursing. The room shifted. Someone coughed. Ashley felt 40 pairs of eyes flick toward her, then back to the screen, the medical equivalent of a courtroom turning in unison. Nurse Cooper decided she knew better than Dr. Harrison about troponin levels. He said it with theatrical concern, the kind of voice people use when they're genuinely worried for you, the performance of decency covering something much sharper underneath. Overstepped her scope. Questioned clinical judgment based on nothing but instinct. The kind of reckless decision-making that gets people killed. That creates liability. That loses us accreditation. The laser pointer circled her signature 3 times. 3 times. Like he was marking a target. Ashley's spine didn't bend. Her coffee didn't move in her hands. But her eyes went absolutely flat, the kind of flat that comes from years of knowing when to disappear, when to be invisible, when to let the room believe you're smaller than you actually are. She'd learned that composure in a trauma aid station in Fallujah, where the walls were concrete and the incoming fire was percussion, and you couldn't afford to flinch because flinching killed people. Prescott was still talking. Something about oversight committees and mandatory retraining. She wasn't listening. She was counting seconds. 67. 68. 69. When he finished and opened the floor for questions, none came. She stood without a word. The chair scraped backward with a sound like a scalpel on tile. Her footsteps were the only noise in the silent auditorium as she walked toward the exit. Behind her, Prescott's face had taken on that particular shade of red that means someone has just realized their performance didn't land the way they expected. He'd wanted shame. He'd wanted visible damage. What he got instead was a woman who simply ceased to be present in his narrative. The humiliation wasn't done. It was only getting sharper. 3 days later, Ashley found herself in the break room at 3 in the afternoon, standing at the vending machine while 2 residents and a respiratory therapist scrolled through their phones nearby. She'd been awake for 31 hours straight, 12-hour night shift, patient handoff, covering for someone who called in sick, 3 admissions, 1 near code she'd caught before it became a code. The kind of tired where your hands move on their own and your mind is somewhere else. She was reaching for a bottle of water when Dr. Prescott entered, his presence announcing itself like a pressure change before a storm. He positioned himself between her and the exit. Casual. Like he'd just happened to want a soda at the exact moment she was there. "You know, Ashley, I've been thinking about you." His voice carried the false warmth of someone about to perform concern for an audience. The residents looked up. The respiratory therapist's typing slowed. "Some of our board members have been raising questions. Real concerns. Important ones." She turned to face him, the water bottle still in her hand. Her eyes were flat again, the same glacial composure that had carried her through a 16-hour trauma rotation while mortars walked across the FOB like methodical footsteps. About someone working in pediatrics. Someone with. He gestured at her forearms, where the scars ran like topography maps across her skin. Surgical scars. Explosion scars. Shrapnel scars that told the story of every time her body had gotten between a patient and disaster. These kinds of visible injuries. Parents talk, you understand. They worry. About what kind of person? She let the silence stretch. Not a flinch. Not a tremor in her throat. Just the weight of her complete attention settling on him like a sniper's scope. Then, in a voice like a scalpel finding the exact space between ribs, "My scars are from saving lives, doctor. What's your excuse for yours?" The break room went completely silent. The kind of silent where you can hear the fluorescent lights humming their electrical song. One of the residents actually set down their phone. The respiratory therapist's chair creaked as he shifted his weight. Prescott's face went from red to purple, not the purple of embarrassment, but the purple of rage, suddenly realizing it had no purchase, no leverage, no power against someone who'd already survived being broken. Ashley turned back to the vending machine. Inserted her dollar. Got her water. Walked past him toward the door with the kind of movement that came from muscle memory and the absolute certainty of someone who'd learned how to make a room feel smaller just by leaving it. She never looked back. But she heard him breathing behind her, fast and thin, the sound of a man's carefully constructed authority collapsing in front of witnesses. That evening, the third one came, and it wasn't subtle anymore. A trauma patient rolled in, chest pain, possible MI, BP dropping. Ashley had already done the initial assessment, called the EKG, initiated the protocol. She was setting up for continuous monitoring when Prescott appeared at the bedside, his presence like something taking up too much oxygen. "I'll take it from here, Nurse Cooper." She was holding the patient's feline steady, had already spotted what the EKG would show, had already begun the mental map of what came next. The patient, a 74-year-old man with his daughter standing nearby, was watching her. "The family needs someone experienced on this," Prescott announced, loud enough for everyone to hear. "For everyone's safety, I think we need continuity with someone more." He paused, letting the word find its target. Stable. Ashley's hands didn't shake. Her voice didn't rise. She simply finished her notation, stepped back, and passed the chart to the nurse he'd reassigned the patient to, a competent nurse, but new, 18 months out of school, still careful in a way that meant she'd ask before she acted. Ashley watched the daughter's face shift from trusting her to wondering what was wrong, why she was being taken away, what had happened to change the equation in the span of 7 seconds. That was the real cruelty. Not the public humiliation. Not the questioning of her scars. But the systematic removal of her ability to help. The implication that something was wrong with her. The suggestion, spoken just loudly enough for the waiting room to hear, that security might need to monitor unstable staff members. She walked to the next station. Checked her other patients. Noted vitals. Moved through the evening with the precision of someone executing a mission plan. Her jaw was set like iron, but her hands remained steady. She'd learned long ago that the people who break are the ones who show it. What she didn't know was that Dr. Prescott was already making phone calls. That evening, he locked himself in his office on the 3rd floor and dialed Richard Chen, a board member who owed him a favor, a big one, the kind involving a malpractice case that had mysteriously vanished 3 years ago with Prescott's help. The phone rang 3 times before Chen answered. Richard. We have a liability situation. Nurse Cooper. I need you at the next personnel review meeting. Yes. Immediately. Click. Second call to Dr. Marcus Irving, who'd worked with Ashley's sparse employment file. Prescott's voice was different with Irving, lower, more confidential, the tone of a concerned mentor. Her references are thin. Barely 3 years civilian. I'm wondering about her service-related disabilities. Her psychological stability. Any gaps in her history? Irving said nothing. Prescott continued. I'm building documentation. Everything by the book. But we need to know if there were incidents. Anything that might explain her current presentation. Click. Third call to the risk management consultant, a woman named Victoria whose specialty was building termination cases so airtight that lawyers choked on them. Victoria, I need your expertise. Nurse Cooper. I need everything documented. Every protocol violation. Every moment she overstepped her scope. I need it by next Tuesday. That's ambitious, Victoria said. Make it happen. Meanwhile, Ashley moved through her shift like a ghost, checking on patients, adjusting drips, catching the small failures before they became big ones. In room 12, Colonel Mercer was asleep, his cardiac monitor showing those concerning ST elevations again, the ones that made her think about his scheduled catheterization in 48 hours. She adjusted his medication, nitrates, a slight increase, nothing dramatic, just the kind of small clinical decision that came from pattern recognition and instinct refined over more than 1,000 emergency procedures. The colonel's eyes opened. You military. His voice was gravelly but sharp, the kind of sharp that comes from watching people for 50 years and learning how to read them. Ashley's hand froze for exactly half a second on his full line. Long enough to hear her own heartbeat. Long enough to feel something shift in her chest, recognition, maybe, or the weight of a secret she'd been carrying for 3 years suddenly feeling heavier. No, sir. Just a nurse. She finished her check without looking at his face and left the room. That night, alone in her apartment in a neighborhood she'd chosen specifically because nobody there knew her before she was civilian, Ashley stood at her kitchen table and opened her wallet. The dog tag was there, on a broken chain, engraved with letters that had worn almost smooth from being held too many times. Her son's name. Killed in Fallujah retrieving that exact chain when a patrol got ambushed. She'd never worn it. Couldn't. The VA appointment card was beside it, PTSD intake, for days away, a date she'd made in a moment of clarity 3 weeks ago when the nightmares got bad enough that she couldn't pretend they weren't happening anymore. She closed the wallet. Set it back in her purse. Outside, rain was beginning to fall against the windows, the sound of it matching the rhythm of her breathing. Somewhere in this city, Dr. Prescott was assembling the machinery that would try to destroy her: board members, lawyers, risk management protocols, the enormous weight of institutional power that takes down one invisible person at a time. She didn't know about the phone calls yet. Didn't know that by Tuesday morning, Victoria would have 3 separate protocol violations documented, that Richard Chen would already be discussing appropriate action in a tone that suggested her employment was a liability to be managed rather than a person to be treated with dignity. She was just a nurse who'd learned to survive. But Prescott was about to discover that survival, when stretched over years and fire and impossible decisions, looks a lot like something else entirely. Something that doesn't need a title to make a room go silent. Something that doesn't wear a uniform but carries it anyway, written in scars and composure and the absolute refusal to break. The rain kept falling. And somewhere in room 12, an old colonel slept with his heart barely holding rhythm, with no idea that the woman who'd just adjusted his medication had once held the line at a combat aid station while the world burned around her. He had no idea that she'd made life-or-death decisions faster than he could blink. He had no idea who he was lying in a bed while his future depended on the competence of someone Dr. Prescott was systematically trying to destroy. But that knowledge was coming. The truth always does. And when it arrived, it would change everything. Colonel James Mercer checked in at Seattle General on a Monday afternoon, his paperwork processed with the kind of bureaucratic indifference that made him smile. Routine cardiac catheterization. Scheduled for Tuesday morning. The arrhythmia his cardiologist had caught 6 months ago had finally progressed enough to warrant the procedure. Nothing dramatic, just the steady wear of 63 years and a body that had spent most of those years operating in climates that didn't forgive weakness. He settled into the pre-op unit on the 4th floor, and that's when Ashley found him. She didn't know who he was. Not yet. Not consciously. But something in her nervous system recognized him the moment she stepped through the door to check his vitals, and she paused for exactly 1/10 of a second before her professionalism locked into place like a vault door closing. Colonel Mercer was reading a 3-week-old copy of The Economist, his reading glasses perched on the bridge of an angular face that had weathered 2 deployments in Fallujah and 3 more across Iraq and Afghanistan. His hospital gown hung on shoulders still thick with muscle, and his left wrist bore the pale tan line of a watch worn every single day for a decade. When he looked up at her, his eyes were the color of old brass, sharp as knives. "Vitals check," Ashley said. Her voice was steady, professional, the voice of a nurse who had 10,000 patient interactions in her background and had learned to compress all of them into the same measured tone. She didn't ask permission. She didn't apologize for the intrusion. She moved to his bedside and began attaching the blood pressure cuff with the efficiency of someone who could perform the task in her sleep, and probably had. "First time?" Mercer asked. His voice carried the unmistakable cadence of a man who had spent his adult life giving orders and being obeyed, not harsh, not arrogant, just certain. "First time for what?" Ashley's hands moved through the checklist without hesitation. She knew exactly what she was doing. BP cuff. Pulse oximeter. Temperature probe. The machines hummed their low mechanical hum around them, and Ashley felt her chest tighten by exactly 1 millimeter, which was the only physical manifestation of anything unusual that would show on her face. "Having a procedure here?" "This hospital?" "No," Ashley said. "I work here." She pressed the button on the blood pressure cuff and it hissed to life, squeezing his arm with methodical pressure. 140/86. Slightly elevated from anxiety, nothing abnormal. Her eyes moved across his monitor readout and parsed the data the way a musician reads sheet music, instantly, automatically, knowing exactly what each note meant. "You're going to feel some pressure. That's normal." What Ashley didn't say was that she recognized him. What she didn't say was that she had seen his photograph exactly once, 3 years ago, in a sealed Pentagon file marked classified that she no longer had the clearance to access. What she didn't say was that Major James Mercer, then colonel of the 3rd Battalion, 5th Marines, had commanded the Dark Horse unit that her son had died defending. The dog tag was in her wallet. Had been in her wallet for 1,247 days. A single piece of brushed metal no bigger than her thumbnail, strung on a chain so broken it barely held the weight of the thing anymore. She had carried it the way other people carried photographs, evidence of a life that had existed, proof that the person who wore it had been real, had been loved, had been worth holding on to even after the Marine Corps had folded his service record and filed it away in a vault somewhere in Quantico with the rest of the dead. Ashley finished the vital signs check in 4 minutes and 19 seconds. Her hands were steady. Her voice never wavered. She explained the pre-op protocol, NPO after midnight. The catheter would go in through the femoral artery, they would monitor his heart's electrical activity in real time. The whole procedure would take between 40 and 60 minutes depending on what they found. Standard information delivered with the kind of rehearsed smoothness that came from having delivered it approximately 847 times before. When she left his room and closed the door behind her, she walked exactly 14 steps before she ducked into the supply closet on the north side of the hallway, and there, in the dark among the boxes of sterile gauze and 4 bags, she pressed her hand against the small of her back where she felt it, the sudden absence of oxygen, the pressure behind her eyes that came from holding something down that had been trying to surface for 36 months. She was in there for 90 seconds. Long enough to remember that breathing was a thing she was supposed to be doing. Long enough to remember that Colonel Mercer was just a patient. Just a man checking in for a routine procedure. Just a stranger wearing a hospital gown. Just someone who had commanded the man her son had died trying to save, and that knowledge was something she would carry silently, the way she carried everything else, with the kind of grace that came from having learned a long time ago that the alternative to silence was the kind of breakdown that would cost her the job that was now the only thing in her life that was real. When she emerged from the supply closet, she was completely composed. The night shift began at 11, and Ashley had worked Monday nights for 2 years, the graveyard rotation when the hospital ran on skeleton crews, and the kinds of emergencies that showed up were the ones that didn't respect schedules or time clocks. She settled into the rhythm of it, the way she always did, moving through the 4th floor with the kind of efficient precision that made other nurses look like they were moving in slow motion. 2 patient assessments at 11:45. 1 medication administration at 12:20. A chart review at 1:30 that flagged potential sepsis in room 412, which she reported to the attending who actually listened to her, unlike some people, and ordered the blood cultures that would confirm her diagnosis by morning. But her attention kept drifting to room 418. Colonel Mercer had settled into the pre-op unit with the kind of composure that suggested he had slept in worse places. She had checked on him at 12:47 and found him reading, had switched to a worn copy of a Tom Clancy novel from the hospital library shelf. His monitor strip showed normal sinus rhythm, steady and strong. His vitals were solid. Everything was exactly as it should be for a man resting before a routine procedure in the morning. And then, at 2:34 a.m., his alarm started screaming. The monitor showed ventricular tachycardia, a rhythm that looked like someone had drawn a chaotic electrical storm across the screen, rapid, irregular, a heart that was trying to vibrate itself out of his chest. Ashley was there in 4 seconds. By 6 seconds, she had the crash cart in motion. By 8 seconds, she was on the phone with Dr. Morris, the second-year resident on call, whose voice carried that particular quality of panic that came from not having seen enough of what was actually dangerous to know which dangers were actually emergencies. VTAC, room 418, pressure dropping, I'm starting compressions, Ashley said. She didn't ask permission. She didn't wait for confirmation. She was already positioning herself to take the weight of the colonel's chest, already feeling the resistance of his ribs under her hands, already counting the compressions the way she had counted them 1,000 times before, 30 compressions, 2 breaths, 30 compressions, 2 breaths. Pain is data, she had learned a long time ago, and the data coming through her hands right now was telling her that something was very wrong. Dr. Morris appeared in the doorway at exactly 2:36, and the look on his face was the look of a resident who realized he had walked into something far bigger than his experience set had prepared him for. "What's his rhythm?" he asked, and Ashley didn't have time to answer because the rhythm changed. V-fib. The monitor flatlined from the organized chaos of tachycardia into the true emergency rhythm, complete electrical disorganization. Death rhythm. Charge to 200, Ashley said, and she was already reaching for the defibrillator pads, was already pulling them from their backing, was already applying them to the colonel's exposed chest with the practiced efficiency of someone who had done this exactly the right way 18 times in her career. The electrical current would restart the heart. Sometimes. If they were lucky. If the window for luck hadn't already closed. The defibrillator charged with its distinctive whine, a sound like electricity gathering its thoughts. Clear, Ashley said, and the current jolted through the colonel's body, and the monitor screen flickered and reformed into something that looked almost like a heartbeat for exactly 3 seconds before it devolved again into chaos. Start epinephrine, Ashley said to the respiratory therapist who had appeared with the crash cart. 1 milligram for push. But the pressure was still dropping. Ashley could see it on the monitor, could feel it in the quality of the chest under her hands. The heart wasn't pumping effectively even when it had a rhythm. The venous pressure was rising. The neck veins were distending. The sounds coming through her stethoscope, the muffled quality that suggested fluid where there should only be space. Cardiac tamponade. Blood filling the pericardium, compressing the heart, making it impossible for the chambers to fill. The colonel was going to die in the next 90 seconds unless someone opened that space and let the blood out. Ashley looked at the crash cart. The scalpel was there, gleaming under the fluorescent lights like something from a different life. She had held a scalpel like that before, had used it on a soldier whose chest cavity was filling with blood from a penetrating wound, had split open the pericardium with a combat knife, no, not a knife, a field scalpel, 15 blade, because even in a bombed-out aid station in Fallujah they had standards about the tools they used. She had done a pericardial window in under 3 minutes while mortars exploded outside and a 19-year-old Marine was coding and there was no surgeon on base and it was just her and her hands and the knowledge that if she didn't open that pericardium in the next 90 seconds, the young man on her table would be dead. The young man had survived. Had made it to the Roll 2 hospital by helicopter. Had been shipped to Germany. Had gone home. Ashley had learned his name 3 months later when a letter arrived at her unit. He had thanked her for saving his life. The colonel's pressure was 60/40 and falling. Get the ultrasound, Dr. Morris said, and his hands were shaking as he reached for the machine, as he tried to angle the probe to see the heart, as he fumbled with the settings because he had never actually done this and he was running on textbook knowledge instead of the kind of bone-deep certainty that came from having seen it in real time. 2 minutes to surgical team, the charge nurse called from the bedside. The surgical team was in the building. They would be here. They would handle this the right way, with proper anesthesia and proper equipment and none of the improvisation that had defined Ashley's previous life. But the colonel would be dead by then. Brain dead at minimum. The window for saving meaningful neurological function was closing like a door. Ashley reached for the scalpel. Nurse Cooper. Step away from that patient. That is an order. The voice came from the doorway, and it carried the kind of authority that came from someone accustomed to being obeyed. Dr. Prescott stood there in his jacket, alert enough to have gotten dressed quickly but composed enough that Ashley understood he had been called by the charge nurse the moment the code had started. He saw her hand hovering over the scalpel. He saw exactly what she was thinking. If you touch that scalpel, I will have you arrested. You are not a surgeon anymore. The words hung in the air like shrapnel. Anymore. The single word that told her he knew. Somehow, in the 3 years since her medical discharge, in the careful civilian identity she had built working night shifts in the ER, trying to be invisible, trying to be just a nurse, he knew. The monitor screamed. The colonel's pressure was 55/38. The surgical team was still 90 seconds out. The colonel's pressure was 55/38. The surgical team was still 90 seconds out. Ashley didn't hesitate. She moved toward the crash cart with the kind of speed that comes from having already survived the worst, and Dr. Prescott's voice cut through the monitors like a blade. Step away from that patient, Nurse Cooper. She was already pulling the sterile field kit open. Her hands moved on their own, muscle memory taking over, the same hands that had held a scalpel in a bombed-out aid station in Fallujah while mortars shook the walls. The same hands that knew exactly where to cut when every second meant the difference between a name on a memorial wall and a soldier going home. I said step away. Prescott's face was flushing red now, his voice climbing. "That is a direct order." Ashley held the 11-blade scalpel up to the light for exactly 1 second. She didn't look at Prescott. She didn't acknowledge him at all. The attending physician, Morris, was still frozen, his hand still raised from where he'd been about to insert the catheter before the tamponade had crashed the colonel's pressure into the basement. Morris watched Ashley move with the terrifying fluid precision of someone operating from pure instinct, and he stepped back without being told. The colonel's chest was prepped and draped. Ashley located the 5th intercostal space at the mid-axillary line, the anatomical landmark burned into her muscle memory from 16 hours straight of emergency procedures under enemy fire. She felt for the space between the ribs. Found it. Knew it. 3 incisions. Clean. Decisive. Like signing her name in blood. The scalpel went in at the anterior axillary line, ran posteriorly along the 5th rib, and opened the thoracic wall like she was unlocking a door she'd opened 100 times before. The 2nd incision extended the field. The 3rd broke through the pleura, and suddenly the lung was exposed, pale and deflated, and beneath it the pericardium, distended and dark with blood that was compressing the heart into uselessness. "Get security up here now," Prescott was shouting into his phone, his voice cracking. "She's committing assault. She's practicing medicine without a license. Get up here now." Ashley didn't hear him. She was in Fallujah. She was in that aid station. She was doing the thing she'd trained for, the thing she'd been born to do, and the room had fallen away into a kind of tunnel where there was only pressure and anatomy and the sound of the ventilator hissing its mechanical rhythm like a metronome counting down what little time remained. The retractor came from the crash cart. She spread the ribs, exposing the pericardium in its full distension. The tissue was taut, bluish, ready to burst. She found the pericardial sac with her fingertip, located the sweet spot, the area below the diaphragm where a single slice would release the pressure without severing the internal mammary artery. The scalpel went in again. The release was immediate. A gush of blood, dark and venous, spilled from the pericardial cavity and down the lateral chest wall. The pressure that had been crushing the colonel's heart for the last 4 minutes finally broke. The monitors, which had been showing the flat line of electrical silence, suddenly began to beep. Faintly. Then stronger. Rhythm was returning. But the heart wasn't contracting well enough. The cardiac output was still dropping. The pressure was still 52/35. The colonel had maybe 2 minutes before he went into full cardiogenic shock, and nothing in this hospital or any other, would bring him back. Ashley's hand slipped into the thoracic cavity. The ribs spread wider under the retractor. Her fingers found the pericardium, found the apex of the heart beneath it, the ventricles, slick and barely moving, struggling against the last dregs of blood volume still pooling in the mediastinum. She began to compress. Not like CPR. Not the frantic, desperate compressions of someone trying to force a dead heart to work again. This was something else. This was the controlled, rhythmic squeeze of someone who understood cardiac physiology the way a concert pianist understands a keyboard. She compressed at the apex, felt the ventricles squeeze under her palm, felt the blood move through the coronaries, felt the perfusion pressure begin to climb. 60. 70. 80. The monitors began to sing. The rhythm was returning. The pressure was climbing. Her hands were inside the colonel's ribcage, and she was manually doing the job his heart had forgotten how to do, maintaining his blood pressure, keeping his brain perfused, keeping him alive with nothing but the simple, brutal mechanics of a human hand squeezing muscle tissue in time with the electrical rhythm that was finally coming back online. "The surgical team is here," someone called out. Morris, his voice thin and shocked. Ashley didn't move. She maintained the compression, steady and unchanged, feeling the heart respond beneath her palm like an instrument responding to a musician's touch. The surgical team burst through the doors in a controlled chaos of white coats and urgency, and they didn't hesitate. They saw the field, they saw the procedure, they saw what she was doing, and they moved into position without a single question. "We've got him," the surgeon said. A woman, tall, with eyes like flint. You can release. Ashley withdrew her hand slowly, maintaining pressure until the moment the surgeon's hands replaced hers, until the moment the internal defibrillator paddle was in position, until the moment the surgical team had full control of the thoracic cavity. Only then did she step back. Her gloves were soaked with the colonel's blood. Her scrubs were stained a deep burgundy from the shoulder down. She had the strange, distant feeling of someone walking out of a moment and back into the world, like a diver surfacing too fast and feeling the pressure change in her skull. Dr. Prescott was standing near the door, his phone still in his hand, his face the color of old concrete. He was staring at her. Behind him, Morris was standing with his mouth open, and the nurses were staring, and the surgical team was working with absolute confidence because they could see what Ashley had done, could see the stable rhythm, could see the pressure holding steady, could see a patient who should have been dead but wasn't. She walked to the scrub sink without a word. Peeled off her gloves. The water was hot and loud, and she watched the blood spiral down the drain in pink spirals, watched it disappear. In the mirror's reflection, she could see Prescott on his phone again, his jaw working, his voice low and furious. She knew what he was doing. She knew what was coming. But that night shift continued, and the next shift started, and the colonel was still alive in the ICU with the surgical team's monitoring equipment and the internal defibrillator doing the work that Ashley's hands had bought him time to do. That evening, at precisely 6:47 p.m., Ashley was called to Dr. Prescott's office. The room smelled like expensive cologne and old leather furniture, and sitting across from her desk were two people she'd never seen before, HR representatives, both wearing the kind of neutral expressions that meant they'd done this many times before. Prescott sat behind his desk like a man who'd already won. Nurse Cooper, effective immediately, you are terminated for gross violation of protocol and practicing medicine outside your scope of licensure. You performed an unauthorized surgical procedure. You endangered this hospital. You endangered every patient in this facility. Ashley sat perfectly still. Her voice, when it came, was flat and cold as winter concrete. I saved his life. You violated federal regulations, the woman from HR said, sliding papers across the desk. You performed a surgical intervention without physician oversight. That is grounds for immediate termination and potential criminal referral to the state medical board. He was in cardiac tamponade, Ashley said. The words were measured, clipped, precise. The attending froze. The surgeon was 6 minutes out. He would have arrested in 2 minutes. I performed a pericardial window using equipment from the crash cart. Standard emergency procedure. You are not a physician, Prescott said. His voice had a tremor in it, and that's when Ashley understood he was scared. You exceeded your scope. You committed assault. You're done here. She didn't argue. There was no point. Prescott had already made his decision the moment he saw her move toward that patient. He'd already decided he was going to destroy her, and the only variable was whether he'd succeed. Security escorted her to her locker. She packed slowly, deliberately, the stethoscope, the penlight, the small notebook where she'd tracked patient details for the graveyard shift. The scrub she'd changed into after the procedure. The clinical reference book that had been her constant companion for 3 years at Seattle General. At the bottom of the locker was her wallet. She pulled it out, and when she opened it to make sure her badge was inside, the dog tag fell out, the single piece of metal on a broken chain, the one she'd carried for 3 years, the one with her son's name on it. It hit the floor and spun once, twice, 3 times before settling on its face. She picked it up. Held it for a moment. The metal was warm from sitting in her wallet. The letters, the name, the rank, the serial number, were worn smooth from being held by hands that had grieved over it 1,000 times. She slipped it back into the wallet. Slipped the wallet into her pocket. Picked up the box with her things and walked out of Seattle General without looking back. For days later, she sat in a waiting room that smelled like coffee and disinfectant and something else, the particular scent of places where broken people came to be fixed. The VA hospital in Houston was smaller than Seattle General, older, filled with the kind of furniture that had been serving patients for 20 years. On the wall, a poster about PTSD. On another wall, numbers for the crisis line. Across from her, a Marine with a prosthetic leg was flipping through a magazine without reading it. Next to him, an Army specialist with burn scars that covered half his neck and face. On the other side, a Navy corpsman with the 1,000-yard stare of someone who'd seen things that couldn't be unseen. They were the same kind of soldiers she'd treated as Major Cooper. The same hands reaching toward her for help. The same eyes looking at her like she was the only thing between them and oblivion. She filled out her intake forms. Name, Ashley Cooper. Reason for visit, PTSD intake appointment. Military service, yes. Combat tours, 3. Years of service, 12. Current symptoms, difficulty sleeping, hypervigilance, nightmares, difficulty trusting authority figures, occasional tremor in hands at rest. That last one was new. The hands, she noticed, were shaking slightly as she wrote. For the first time in 3 years of maintaining absolute control, of building a civilian identity brick by brick, of pretending to be just a nurse, just a person, just someone ordinary, for the first time, her hands were trembling. And then, that's when the real nightmare began. The termination letter was waiting on her locker door at 6:47 p.m., printed in institutional grey typeface, signed by Dr. Prescott and countersigned by the hospital administrator who suddenly couldn't meet her eyes. Gross violation of protocol. Practicing outside scope. Unauthorized surgical procedure. The words sat on the paper like stones dropped into still water, and Ashley read them 3 times, her fingers steady, her breathing measured, her composure a wall of reinforced concrete that refused to crack in the fluorescent buzz of the locker room. 2 other nurses pretended to not watch her. They failed. She pulled her personal items into a canvas bag, a spare stethoscope, the photograph of her son in dress uniform taken the year before Fallujah, the small plant someone had given her on her first day that she'd somehow kept alive for 3 years. Her hands moved methodically. Clinical. Detached. The way she'd been trained to move when the world around her was collapsing. The way she moved when it mattered. The dog tag had been in her wallet since the day the chaplain brought it, threaded on a chain that snapped in a convoy explosion that killed 4 men and left 1 breathing and 1 not. She kept it hidden beneath her scrubs every shift, a weight against her sternum that felt like penance and purpose braided together. As she reached to close the locker, her hand bumped the edge of the bag. The chain snagged on the zipper. The tag slipped free and fell. It hit the tile floor with a single metallic chime. So small. A sound that echoed differently than it should have, like the universe was drawing breath. Ashley stared at it for 2 seconds, just 2, watching the chain coil around the metal like a snake, watching the engraved name catch the overhead light. The other nurses had turned away. No one had seen it. No one would ever know that the strongest nurse they'd worked with, the one who saved patients with the precision of a surgeon, the one who looked unbreakable, had just watched something break on the floor and left it there. She picked it up. She didn't put it back in her wallet. This time, she looped it around her neck beneath her scrubs where it belonged. Where it had always belonged. Then she left Seattle General without looking back at the ER entrance, without saying goodbye to the staff who would spend weeks debating whether she'd really been reckless or if Prescott had finally shown his true shape. She already knew the answer. For days later, Ashley sat in the waiting room of the VA hospital in Houston, in civilian clothes, jeans, a coffee-stained sweatshirt, hair pulled back in a way that made her look younger and smaller and less like someone who'd held the line at Fallujah's main aid station for 16 hours while mortars destroyed everything around her. The intake counselor had called her name twice before she heard it. PTSD appointment. The paperwork had taken 40 minutes. She was a civilian now. A nurse with a discharge date and a service-connected disability rating and a prescription for nightmares that didn't work. The veterans around her waited in that particular way that soldiers wait, quiet, patient, watching the doors and the exits and each other with the kind of awareness that doesn't switch off even in peacetime. An older man 3 seats down had the look of someone who'd carried weight for a long time. A younger guy with one arm kept glancing at the television on mute. An African-American sergeant with hair graying at the temples sat reading a battered copy of a thriller, but his eyes kept tracking the hallway movement. One of them was staring at her. Not obviously. Just the way her eyes caught his in the peripheral moment when he pretended to adjust his seating. She knew that look. She'd seen it in 100 aid stations across Fallujah when soldiers recognized another soldier masquerading as civilian. Not surprised. Just noticing. Just knowing. She held his gaze for exactly 1 second and looked away first. A small offering of acknowledgement that wouldn't be questioned, wouldn't be explored, wouldn't become a conversation that would fracture her carefully constructed normalcy. But that wasn't the worst part of those 4 days. That wasn't the worst part at all. Because while Ashley sat in that VA waiting room learning to name her trauma with a therapist whose hands had never performed surgery under fire, Dr. Prescott's entire career was collapsing with the sound of a building imploding on itself. The security footage that had been mysteriously deleted, the footage of Colonel Mercer's cardiac tamponade, of his flat line, of Ashley's hands performing the thoracotomy that saved his life, wasn't actually gone. Not completely. And the person who had access to every server, every backup drive, every redundant system in Seattle General's network was a trauma medic named Rodriguez who'd served 3 tours as a 68W combat medic with the 75th Ranger Regiment and who had watched Prescott delete the files at 11:47 p.m. on the night of the code. Rodriguez had been processing the security tapes in the IT department. He'd seen the deletion log. He'd recovered the files from the backup partition. And he'd spent 4 days wrestling with whether to report it through hospital administration, which meant Prescott's friends, his network, his 3 board members who owed him favors for malpractice complaints they'd buried like bodies in a mass grave. On day 5, Rodriguez walked into the office of the Texas Medical Board senior investigator with a flash drive containing timestamps, deleted file logs, and security recordings that showed Dr. Prescott moving through the hospital at midnight like a man committing a crime. Because he was. Because destroying evidence of a life-saving procedure performed by someone he was trying to bury was more important to him than the patient's recovery. The investigation took 48 hours to launch. It took 1 week for Richard Chen to distance himself, producing emails that suddenly made him look like he'd been misled about the personnel issue and recusing himself from all related votes. It took 2 weeks for the risk management consultant to produce correspondence showing Prescott had explicitly instructed her to find grounds for termination regardless of actual performance reviews. It took 3 weeks for the state medical board to recommend the suspension of his medical license for evidence tampering, falsification of medical records, and patient endangerment. It took 4 weeks for Seattle General to terminate his contract and issue a formal apology to Major Ashley Cooper, who'd returned to find her job reinstated with full back pay and a letter from the hospital administrator that practically wept from the paper. But she didn't go back to Seattle General. She had an offer instead, a position created specifically for her, waiting at the VA hospital in Houston where Colonel Mercer had made a single phone call that opened doors all the way to the Pentagon. Head of Emergency Services. The kind of promotion that comes when you save a retired Green Beret colonel and his family decides you need elevation. The kind of role that whispers your name through military networks before you even accept the job. Dr. Prescott's medical license suspended for evidence tampering. His contract terminated. His malpractice insurance skyrocketing past any amount he could afford, which meant no private practice, no consulting work, no salvage operation for a career that had been built on intimidation and institutional memory. 34 years of medicine, gone in 6 weeks. His bank accounts would drain. His house would eventually list. His name would appear in medical board proceedings and state licensing documents that anyone could find with a simple search. He was unemployable as a physician. 6 months later, broke and desperate and out of options, he took the only medical job available to someone in his position, a position that paid minimum wage plus mileage, that required him to push carts of medical supplies through the same corridors where his victim now trained the next generation. Medical supply driver for the VA hospital. Every Tuesday and Thursday, his route included the emergency department. Every Tuesday and Thursday, he wheeled past her office, past her name on the door, past the resident she was teaching, past the plaques on her wall and the framed citation from Colonel Mercer thanking her for saving his life twice. Once in Fallujah. Once at Seattle General, when she cracked his chest with a scalpel and held his heart in her hands and didn't let go. Through the window of the emergency department, he could see her sometimes, standing with the morning briefing, and gesturing as she explained procedure adjustments, her voice carrying the kind of authority that makes people listen. The voice of someone who'd held a line under mortar fire. The voice of someone he'd tried to bury. The supply cart wheels squeaked against the polished hospital floor as he pushed past her office door, head down, eyes forward, refusing to acknowledge the woman who'd demolished his entire life by simply being competent and honest and unbreakable. He didn't know that she'd stopped mid-conversation with a resident to watch him pass. He didn't know that she recognized the shape of his shoulders and the angle of his defeat, and that she felt nothing, no satisfaction, no anger, no justice. Just the hollow certainty that some debts are paid not in moments of triumph but in 1,000 small humiliations watched through windows while someone else heals what you tried to destroy. If you found yourself invested in Ashley's journey, in the way she refused to break under pressure, in the power of quiet strength misunderstood, subscribe now so you never miss another story about the warriors among us. Like and comment below, what would you have done in her position? And remember, sometimes the bravest warriors carry stethoscopes, not guns.